Welcome to New to Medicare. This program is hosted by Manchester Community Library and is presented and sponsored by Southwestern Vermont Council on Aging and CHIP, which stands for State Health Insurance Program. Today's program is being recorded. Please use the chat feature to post any questions you have along the way. Ray Stevens, the library's information technology and instructional librarian, will handle the tech aspects of today's presentation. Thanks very much, Ray. Libby Graney is our knowledgeable presenter. Libby is employed by the Southwestern Vermont Council on Aging as a state health insurance program coordinator, and she does that for Bennington and Rutland counties. These positions are federally funded and serve as a source of assistance for people navigating the Medicare process. Libby relocated back to Vermont in 2014 after working in healthcare administration and physical practice management for several years. She's also served as an adjunct faculty member in healthcare administration for many years at various universities and colleges. Thank you so much, Libby, for being here today.
Thanks, Cindy. Well, welcome everybody to the wonderful world of Medicare. And feel free at any time to add video to your options so I can see your face and say hello. And I'm going to just talk a little bit about the essentials of Medicare. And then I'm going to show some documents, like some PowerPoint slides that basically reinforce the concepts that I've said. And then I'm going to go back to my face and the video, and we can basically just chat a little bit, and you can ask any questions. I've found that that's the most helpful thing when we do these monthly Medicare classes. So in terms of Medicare is a federal health insurance program which you enroll for Medicare through Social Security. Medicare was started in 1965, believe it or not. And Medicare consists of two main parts. Part A is hospital coverage, and Part B is medical coverage. Those are all the doctor visits, etc. Your first step in entering the Medicare world is to enroll in Medicare Part A and B, and you get your card, and you have a randomized digit number on it that's yours for life, and it'll tell you the effective dates for A and B. After you get A and B, you have two decisions to make. The first decision is to buy and pay for a supplemental policy. A supplemental policy is also known as a Medigap. Same thing. The purpose of a supplemental is to pay the portion that A and B does not pay. In other words, 20% of all the Part B charges are on you. That's why people choose to buy a supplemental policy. And we can get to all the detail on which one and how to choose that in a few minutes. Your next decision is to consider what's called a Part D Medicare drug plan. These are standalone prescription drug plans that only cover drugs. That's it. So if you choose that way of getting all of your Medicare, you'll have your Medicare card, you'll then have a supplemental card, you will then have a prescription drug plan card. All right? That's how most people get their full Medicare coverage. The other option to get your Medicare coverage are these plans called the Advantage plans, and they're advertised all over the place. What the Advantage plans are is what they do is they say, well, we do everything in one. So you get your A and B card through Social Security, and then if you choose, you say, well, okay, I like the looks of how those Advantage plans run, so I'm going to do it in an Advantage plan format. Those Advantage plans are actually what Part C is. See, Part C is just the Advantage plan option. So the Advantage plans say, well, we're going to combine your drug coverage. We're going to determine what networks you can use, all for a lower monthly premium. So if there's one thing you leave this little seminar with is to understand a supplemental policy is not the same thing as an Advantage plan. Okay? They're two distinct and separate ways to complete your Medicare coverage. And I've got some handouts I'm going to show you. So very distinct point there. That remains the #1 source of confusion for the American people trying to figure out what's the difference between getting a supplemental policy or those Advantage plans. All right, so that's the main difference. And we'll go over a little more detail. The two main populations of people that are eligible to enroll in Medicare are those that are 65 and they choose to enroll then, or if they're younger than 65, but they have been on disability for 24 months or longer. And if they've been classified as disabled for 24 months, they are also eligible for Medicare in the United States of America. And then they face the same decisions you do after turning 65. Okay? The other thing is, if you turn 65, but you don't want to enroll in Medicare because you're gainfully still employed, which many people are, and you've got large group health insurance coverage through your employer, you do not need to enroll at 65. You can simply stay on that large group employer coverage. Why not? Then, when you're ready to retire, whenever that is, you can then enroll in Medicare at any time of the year when you're retiring. And it's called a special enrollment period. So no late enrollment penalties, none of that fear of late enrollments. You are fine if you have been continuously covered by a large group employer plan. So if you work till you're 66, 67, 68, no problem. Okay? You will just wait to enroll in Medicare if you've got good group coverage, and then when you're ready to retire, and you know when your employer group coverage is ending, you then enroll in Medicare Parts A and B, and you'll want to have that start right when the employer group ends. Okay, so that's a lot of education right there, because a lot of people hear, oh, I have to enroll at 65 or I'm going to get a penalty. Not if you're covered by an employer plan. okay? But yes, if you're not working, you have no other insurance, and you turn 65 and you don't enroll, yes, you will lose a little bit because you would have not enrolled during your initial enrollment period at 65. And they'll charge you a little more if you wait. What they don't like is gaps, okay? Like they don't like gaps if you just kind of wait around and didn't get it done. So those are the two things that I am finding I want to really educate people on is when can you enroll? And the fact that after you've enrolled in parts A and B, where it all starts, you can choose to go the Advantage Plan route, where they do the drug coverage in one with their coverage, or the A and B card with a supplemental policy, and then a drug plan. So you will have 3 cards in your wallet: A and B, the supplemental, the drug plan. If you say, well, I'm going to go with those Advantage plans, I understand how they work, you'll carry 1 card in your wallet and it'll say Advantage Plan on it. And in the corner, it'll say RX coverage, which means the drug coverage. Okay. So before I go, and I'm going to follow up now and show you some slides of exactly what I've just said, do you have any questions right now that we could go over? Okay. So,
Libby,
yeah,
you'll talk about the difference between Advantage and the supplemental, what?
yep.
Okay.
I'm gonna show some slides which will reinforce the narrative that I've just done. Okay, so for all of you looking, I can show this again at the end, but clearly you can email me anytime for further information and counseling for any particular Medicare needs. And right there is my work email for this. Just so you don't have to feel pressured to remember everything tonight, obviously. Here are the folks that I mentioned, the main groups of population that are eligible for Medicare. Your Medicare card, see, some of you out there may already be on Medicare and just, getting a refresher, or some of you are planning ahead for when you are on Medicare. So this is what the Medicare card looks like. And, they'll give you a randomized number. Hospital is part A and the medical is part B. So like I mentioned before, after you have parts A and B, which is where it all starts, you see the medical card on the left, part A and B, and then you'll see with a supplemental. The supplemental policies pay the 20%, the deductibles for part A, that otherwise, if you just walked the streets and just had an A and B card in your wallet, you'd have pretty good coverage, but those 20% charges can add up quickly. So that's why people get and buy a supplemental policy. Then if you go that route, you will then consider what's called Part D, and those are the drug plans. And there's like 21 of them that are sold in the state of Vermont. And obviously we can help you determine which plan is best for you. So you see what I mean is that's your first option, and you'll have 3 cards for full coverage. Or what they call Part C. Those are the Medicare Advantage plans, and they started that in the 1980s when they thought managed care, you know, was the best thing since sliced bread, HMOs, where they limit the network where you can go, all that. So they determined they would like to give Medicare people an option to say, well, okay, I can understand how they work. They limit your network. They have out-of-pocket costs, but I understand it, so that's how I want my Medicare. All right, and that's what Part C is, actually. It's those Advantage plans, sold by and approved by Medicare to do so.
So Libby?
Yeah.
So with an Advantage plan, you have a limited choice of medical providers.
That's right.
Whereas with Plan A and B, you can go to anybody in the US.
Yes. If you carry your red, white, and blue card with A and B, and you get a supplemental policy, you can go anywhere in the 50 United States to a Medicare provider. No questions. But if you sign up for an Advantage plan and you read it carefully, and I'm going to show you a resource where you can actually read across the columns and understand their network, their premiums, their co-insurance, etc. But trust me, if you do not go to one of their network providers in those Advantage plans, you will pay. All right? So when people first compare the pricing of a Medigap or a supplemental policy, which can average about $177 a month, to the Advantage plans that can be like 20, 30, 40 bucks a month, they're like, oh my God, hey, those Advantage plans. But the point is they have to consider the fact that they have co-pays at the doctor, they have co-insurance for durable medical equipment, they have co-insurance for cancer drugs if they get an Advantage plan. If you pay more per month for the supplement, medically, you will not have a lot of out-of-pocket expenses, period. All right, that is the main difference. So comparing those two adequately is key to your decision. Part A covers hospitalization and your skilled nursing facility care and hospice. Skilled nursing facility care can be anything from like post-hip surgery, post-hip replacement, knee replacement, heart surgery, where you have to be in an inpatient rehab facility, and this can happen easily. Part A covers that, okay? But you can see that it has a deductible that you owe of $14.80. A supplemental policy pays that. That's why you buy one, okay? Part B medical is all the doctor visits, x-rays, colonoscopies, durable medical equipment, everything that's outside of the hospital falls under Part B. So this is a majority of your services. Now here's what's interesting. When you go on Part B, you will indeed owe Social Security a monthly premium every month for Part B. This year, it was $144.60. You will owe that to Social Security. There's also now an annual deductible for Part B services of $198, which means you will pay up to that for Part B services each year, and then you're done. So they're making, starting in January, all new to Medicare enrollees, you'll have to pay that. People used to be able to buy a supplemental policy that paid that deductible for B. We can't do that anymore, not if you're coming along later. So that's thanks to Congress who passed that law. The big one is the co-insurance of 20% that you owe for all Part B services. A supplemental policy pays that. The drug plans cover drugs, only prescription drugs, that's it. So that's why with our system set up the way it is, you need to purchase a Part D Medicare drug plan. Now, yes, people get scared because they hear, oh my God, there's a late enrollment penalty if I don't enroll right away. There is, but it's small. It's about $3 approximately that's added to your monthly premium for each year you delayed enrolling in a plan. That's it. Okay? The government is obviously incentivizing people to get it all done first and right away when you're eligible. If you are on a few medications, like 3, 4, 5, you should consider one. But I have clients who say, well, I'm not on anything, right? I don't have any prescriptions. Why should I buy another prescription policy, pay a monthly premium, another deductible? Okay. So I say I absolutely understand that thought, because you can just pay for your drugs, pay for generics, cash. I get that. And that's okay. But there's two things that I need to tell them. One, you'll pay a little bit more when you do enroll, and you can only enroll every fall during open enrollment. So let's say you go without a drug plan and you get a stroke or you get nailed, and it's April, it's May, it's June. Guess what? You don't have drug coverage through an insurer, so you'll have to wait for fall annual open enrollment to enroll in a Medicare drug plan, and it will be effective that January. So that's that. But I completely and totally understand the logic where people say, well, you know, I'm not on anything. And I get that. But they also just have to realize when they can enroll, and it'll be a little bit more on their premium each month. And you have the option, by the way, of every fall of checking to see if your plan is still the best plan for you, drug plan, and you have the option of changing plans every fall if you want to, because your meds can change or the plan's formulary can change. So that's kind of like an escape hatch that they've created, where every fall, it's called annual open enrollment, and you can switch drug plans if you want. But if everything's working perfectly and you're fine, you don't have to do a thing. It just keeps rolling over. The supplemental insurance is also known as a Medigap because it's literally covering the gap of coverage in A and B. A and B covers like 80% of the cost. The 20% is on you. So a supplemental insurance policy comes in and pays that on your behalf. And I've got, you know, links here that will take you right to some monthly rates. And I even have a sheet I can show you for today. When I go back to video, I'm going to show you what's called the Medicare and You book. Extremely helpful book, you guys. If any of you are sitting out there and you're either on Medicare and you have this book because they mail it out, dig it out. Or if you have friends that are already on Medicare, ask if they've got theirs at home because they mail them out. And I can get in touch with you and I can reference certain pages for you that are extremely helpful in understanding some of these concepts. Because believe me, it does get complex very quickly, so I'm very cognizant of that. So I focus on the main points, and then I'm always available for further questions, you know, personally, to just reinforce some things. And what this sheet's showing you is what I told you, that, you know, they're constantly changing Medicare. And one of the things they changed was when you were new to Medicare prior to this January, you could buy an F or a C supplement, and that would have covered that Part B annual deductible. But now, if we come along on Medicare after January of 2020, we don't even have the option of buying an F or a C. So the richest plan will be a G, and I'm going to show you what I mean by that. And this is just, again, I'm reinforcing what I verbally said to you. The Medicare Advantage plan, if you get marketing material and you're flooded with marketing, look at what they're trying to sell. Are they selling you an Advantage plan, or also called Complete? Or are they selling you a supplemental? Once you figure that out, you're going to know what they're trying to sell you, because they're two distinct, separate ways of getting your Medicare. And remember that the Advantage plans, they're all in one. So they're going to say, oh, we offer dental, we offer vision, we offer. Okay, again, though, make sure you ask the detailed question on, okay, how exactly do you offer vision coverage? And that's prescriptive lenses here. How exactly do you add dental? Because legally they can say, oh, well, we cover dental, and then they can charge you 50% of everything. So you're like, well, is that worth it? Because I'm paying for it anyway. So it gets very detailed, and they sound like they're offering everything, but just understand exactly how they're doing so before you enroll. Because that's how they keep the premium down, is because they limit your network, which tightens it up, and then they charge you office visits, co-pays, etc. Whereas a supplemental, if you get the G plan, which is the best you can get, you have no co-pays. So this is the number one thing. If you're going to be new to Medicare, very few Americans understand this slide. You now do. An Advantage plan is not the same as a supplemental policy, okay? Not the same. They operate completely differently. And I'm going to show you the book. And if you want me to mail you one, I can definitely do that easily. Or if you have access to the 2020 book, this is where I can reference pages for you. So the visual that I show people in their entry to Medicare is the visual is your first choice once you get Part A and B is to get a supplemental policy and then a drug plan. So you'll have 3 cards. Or you'll say, okay, I'm comfortable with how the Advantage plans work. I understand that they're a managed care format. They include my drug coverage. And you say, okay, sign me up for your Advantage plan, and they'll send you a card. And then that's the one card you bring everywhere. So that's the visual. And it's very clear and helpful to your 2 choices of direction. I will tell you that 70% of all current Medicare enrollees do it this way with the three cards. About 33% of all Medicare enrollees are doing it the Advantage plan way. But Medicare is really pushing these Advantage plans, and you see they're advertised on CNN like constantly. And Joe Namath thinks they're the best thing. And they're pushing them because they think it's going to save Medicare money. It might, but as long as you understand how they work, that's it. This is another visual that I think helps clients understand. These are what these cards will look like. This is an example of a supplemental policy to go with their A and B card. And this person chose Plan D. And I'm going to show you what that means. Plan D is simply where it covers very similar to the G. And I'm going to show you a chart and it'll make sense. Here's what another Medicare supplemental card looks like. So this is where you know that this client has a supplement, and they chose the F coverage, which means they were on Medicare prior to this January, so they had that option. This is an example of a drug plan card. So that would be the 3rd card for your drug coverage. This person has the WellCare Classic plan. And that's what a drug plan card would look like. Okay, so here is what an Advantage plan card. It has, this is AARP, they're one company of many that sell them. Notice it says Medicare Complete. You see, they use that term because it includes their drug coverage. It's all in one. Notice here, that's your indicator that it includes their drug coverage. And that's exactly what I mean. So they would send you this card and you'd take it everywhere. But notice that you have copays and you have specialist visit copays. You see? So you have a lower monthly premium, but you have constant cost sharing every time you go. Versus the supplemental policies have higher premiums, but you're not forking out every time you're going. That's the difference. So it depends on how you want to spend your money. So how do you enroll in Medicare? All right. If you are approaching 65 and you're not working and you want to be on Medicare, but you're not yet collecting on your Social Security earnings, that's fine. It means you're just waiting till you get your full boat, which is smart. But if you're not yet collecting, you simply have to actively enroll with Social Security for Medicare Parts A and B. That's it. Okay. So you call them, or you can go right online, click Medicare enrollment, and you can literally do it right online and get Parts A and B. Or you can call, and I put the Rutland number right here. If you are collecting your Social Security already, like at 63, 64, and now you're turning 65, you will get your card automatically. So when you're turning 65, you're already in their system. So boom, it's easy. They're going to send you your A and B card, and you'll have an effective date of the first day of the month you turn 65. And then you're like the rest of everybody else. You face the decision of a supplemental policy and a prescription drug plan. And again, I'm going to reference this if some of you don't have friends with it, or some of you I think may have it. I'm going to reference these certain pages that are extremely helpful and reinforce what I have verbalized to you today. And then this is just reiterating the annual open enrollment, which is if you want to switch your drug plan, you can, but you don't have to, but you can. And people that get into those Advantage plans and then change their mind and want back out and want to go the other way, they can do so during fall open enrollment. So then they get out of the Advantage plan, they go back to original A and B, they buy a supplemental, and they buy a drug plan. It's just a time of year when they can choose to change their mind. So, with everything else, they're really pushing online. And I know I hear the same thing every day, online, 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 but they're recommending that everyone set up their own Social Security account, and it's called My Social Security, and it's actually pretty helpful. I've got one. They'll literally tell you all of your earnings statements from when you started working. They'll tell you what your estimated payment will be at like full retirement age, early retirement, etc. Very helpful. The other one that's very helpful is right here. We set these up a lot for clients because it's quick and easy, and then we just send them their login info. But right here, once you're on Medicare, you can set up your own Medicare account, and then you can go in and put in your prescription drugs, etc. And very helpful. And we can help you do that as well. Obviously, on a separate call or whatever, I can give you more detail on, there are programs through the state of Vermont where if you qualify, you can get assistance paying for, you remember that 20% and those deductibles for Part A and B for which people buy a supplement? Well, if your income and resources is of a certain level, state of Vermont comes in and can actually pay those for you. So those are available through Green Mountain Care. The state of Vermont comes in and offers pharmacy assistance. And there's different levels according to your income and resources. And then I can obviously get you these slides for detail at any time. But there's a lot of resources locally. Yeah, I've certainly seen this quite a bit. And then that's the summary of those slides. So there's one more I'm going to try to pull up on those choices of the supplemental, like the G, the F. You're like, what is that? I'm going to try to pull that one up. Now, this is from the Medicare and You book. It's right on page 70. Okay, long story short. All the sheet is showing you is on the left are all those out-of-pocket costs that come with parts A and B that you owe. Like the Medicare Part B coinsurance, that's the 20% I talk about. Skilled nursing facility care coinsurance, the Part A deductible of $1,460. This Part B deductible of $198 a year, that's the one that recently, you see where the F plan would pay that 100% for you? Well, it's no longer eligible. If we're eligible to Medicare after January 2020, the richest plan is the G, which is the same coverage of all those costs, except, do you notice how the box is empty now? See? It's empty, which means you will have to pay that $198 a year toward the Part B. Whereas look over in the F column, F all the way down, notice what it says in the Part B deductible box. See, it pays that. So that's really what the difference is. Now, the N is the other choice people look at because, again, it covers the big ones, Part A, deductibles, etc., 100%. The Part B, 20%, does not cover the deductible for Part B. But you see these little asterisks, right? Well, right here. Plan N pays 100% of the Part B coinsurance, except for a co-payment of up to $20 for office visits and up to $50 for emergency room visits. So what they're telling you is that if you're okay with paying $20 for your co-pays, what you're going to see when I show you the rate chart next for the supplementals, you're going to notice that the N plans are less money per month. That's why. Because they know you have to pay co-pays. Okay, so Part B excess charges are very, very rare. And there's only 6 states that even allow them. Vermont does not allow them. And what the excess charge means is if you go to a Medicare provider, and you know how you look at that, the explanation of benefits they send you, and it'll say, doctor charge, Medicare allowable, right? The allowable is what that doctor is going to get paid. An excess charge is when the doctor can charge you over that allowable. So it's very rare. Vermont doesn't allow it, and there's only 6 states right now that do allow it. But it even gets more complex because if the person is a Medicare provider, they can't charge an excess charge. It's only if they don't accept Medicare and you choose to go to them anyway, then they're allowed to charge it. Okay? So it's a good observation you're making, because the D and the G are identical in their coverage. You see, they don't do the deductible, but Part B excess charge. The D does not cover it, while the G does. So guess what? When you look at the rate chart, you're going to notice the D and the G are priced exactly the same. So of course you're going to tell a client, well, get the G. But the other thing that should tell you is that if it's priced the exact same, it means the insurance companies know it's hardly a problem. So they're going to charge you the same rate. See, when a provider or a hospital chooses to sign a contract with Medicare or with Blue Cross, Cigna, Aetna, United, when they choose to sign the contract and they're an in-network provider, that means that they cannot accept anything more than what that allowable is. That's it. Okay? So that's why when you go to an in-network provider, they always encourage you to do that, because it's not gonna be a problem. So did that help, that question? Good. So this is the chart. And so to be honest, the D and the G are the same, except what that person noticed is the excess charge box is different. And that's what that is. But it's extremely, it hardly even happens anymore. That's why they're priced the same. Okay. So now that we've done that, I want to, so now that we have talked about your choices for those letters and the supplements, like, okay, so hopefully now you have a better understanding of how much the D covers, the G. Let me see. Is that better? Bigger?
Yeah, that's looking good.
So, all right, so we talked about, let's look at the G, which is what most of you, if you're new to Medicare, would be looking at. Here are the monthly rates for that full G coverage. All the Part A deductibles, all the 20% charges for Part B, etc. So G is right here, and this Medigap Blue, it's a Blue Cross, the Vermont Health Plan Medigap Blue, is when you're first turning 65 or you're coming off an employer plan, you are eligible for that rate, which is very good. Great question. So here's the answer to that. These are both Blue Cross products. But this Medigap Blue is only available to you during your initial enrollment period when you're turning 65, or when you're coming right off an employer plan. That rate right there is why they incentivize you to enroll right away. It is, but here's the deal. If, let's say, you're a person, and they exist, trust me, that they get their A and B card, they're like, I'm healthy. I don't need to buy a supplement, right? Nothing's gonna happen. And then 3 years later, they need to go and they need to shop for a supplemental because they're getting sick. If they knock on Blue Cross's door, Blue Cross will say, yeah, but the only one we'll sell you now is this one. because they don't like gaps. So, and that's a really good question. This chart comes from the Division of Finance and Regulation website for the state of Vermont. Right here you see. And obviously, they could be much more clear on a lot of this. They could write little notes. They could explain that, but they don't. So we do, and we explain why is there such a difference, and why is it if you're past your enrollment periods, they will not sell you this product. They'll sell you this one because you're higher risk, you guys, right? You're higher risk if you've waited around, you haven't been covered, and then you get sick. And you know how it goes is, you know, you don't buy insurance when you get sick. Yes, and it sounds like a lot, and I understand that, trust me, but just realize once you have those, you have little out-of-pocket costs. And your network of providers is anywhere in the 50 United States. So I'm going to show you how to look at the Advantage plans too, which have the lower premiums. But if you're okay with that, and you say, well, you know, we're relatively healthy, we're okay with the, you know, the as-you-go expenses, then that might be an option for you after you've looked at this. But, you know, it's called making an informed decision. I would recommend too, you know, United Healthcare works with AARP down toward the bottom, and they're not badly priced for the G at 196. And, you know, people like AARP. And the USAA, it's a military, obviously, as you know, connection. But we've recently found out that you don't have to have military service in order to ask them about their Medigap policies. And they have not updated their prices, but if you want to call them directly and ask them about their G, see what they say. But right now, they don't have their price there. Okay, this sheet, everybody, is 2020. These are your costs. These are the costs that a supplemental pays. The hospital deductible right here. Skilled nursing facility copayment. No copayment if you're in less than 20 days, but if you're in for post-hip surgery or complications or who knows, strokes, I don't know. Once you hit 21 days in a convalescent center like CLR here in Bennington or Bennington Health and Rehab, you owe $176 every single day. A supplement pays that. Most of you will not have to worry about a Part A monthly premium because most of us have worked long enough to have paid through payroll taxes where we do not have a monthly premium for Part A. Here's that annual deductible of $198 that I keep talking about, where the G plan pays everything else except that. So, and that's new. So once you've paid up to that, you're done. So it's really not too bad. The Part B premium is right here, and that goes to Social Security every month after you're effective. Yes, that goes to them every month. If you're collecting your Social Security, they will take that right out of there for you every month. If you are on A and B, but not collecting your Social Security, they will simply invoice you for the Part B premium. And the big one down here is the 20% that of Part B charges that we all owe. You know, $3,000 MRIs, all that testing, you know, 20% adds up very quickly. And if you don't have it, you notice very quickly that you wish you had a supplement. So, you know, that's where the apples and the oranges, you got to compare. It's like any other financial decision in your life. You know, what's your risk tolerance? Have you gotten much savings in the bank to cover it? You know, I don't know. Or you buy a supplement. So there's that sheet, which I hope kind of makes that more clear. Okay, so what Cindy's holding up, you guys, is in the Medicare and U book, Advantage plans are listed for Vermont 2020. MVP and United Healthcare are the two companies that are selling Advantage plans in Vermont. If you get the book or I mail you one, you can see the companies are listed and then they're different plans. And then you read across the columns, their network, where you can go, their co-pays, their out-of-pocket limit. Some are as high as $6,700, durable medical equipment, etc. So that's why the book is extremely helpful. It intimidates some people, but it'll help you understand, oh, okay, how is that Advantage plan going to work before you sign up? Or you ask the people that you're buying it from. And so these are the books that go out every year. And a very important part of the book every year is on page 121. 4 pages of drug plans, right? Medicare drug plans. And that's for when you're searching for getting a drug plan. If you've got the Medicare A and B, your supplement, and a drug plan. And there's all these choices. And how you know which one is best for you is that you run your medications and your pharmacy in your area, and we can help you determine the least costly plan to you, and then you enroll. Or again, if we talk personally, if you're not on any meds, there's 2 or 3 that I would recommend that are like $14 a month. And, you know, if you want to just feel better if you're, you know, if you're enrolled in a drug plan. Okay, so the Medicare drug plan, you literally go right to the company. A and B through Social Security, you enroll. The supplemental policies, whichever individual insurance company, you enroll. And then the drug plans, you see there's 4 pages of them. They all have phone numbers, they all have websites. Or what we do, like my colleagues and I, is we run all your meds for you if you want us to in the plan finder. We look at pharmacies, we find the least costly plan, we show you the printout, and you either enroll yourself or we go online and enroll you for you and send you the confirmation. It's intense stuff. I know, you guys. I wish it was easier. But once you're enrolled, you're pretty much set to sit back and just relax. So, what can I say? Those are the essentials of Medicare. No, ma'am. If you are retiring and you are coming off an employer large group plan, you are now enrolling in Medicare, you can enroll in the supplement and you can enroll in the Part D plan anytime when you're retiring. No penalty at all, but the key is if you work for a large employer that has more than 20 employees, you can delay getting on Medicare as long as you want. There are
Okay,
times, and the HR people should tell you this, is if you work for a small company, less than 20 employees, many times their insurance plan makes people go on to Medicare as their primary payer if they're still working at 65, and the plan's coverage becomes the supplement. Yeah, can't make this stuff up. So that is on page 20 in the Medicare and You book, and they have columns of what is your situation, and they literally say if you're over 65 but still working for a company less than 20 employees, Medicare pays first. And then your company for which you're still working will be your supplement. And again, don't shoot the messenger. I don't make this stuff up. But once you get there and you're all enrolled, you're going to be fine. You know, it is pretty good coverage once you have it. But that's why I really push these Medicare books. And a lot of people that get them mailed to them, they kind of just throw them away. But if you need one, email me and I'll mail it to you. Or if you have a friend who's already on Medicare, typically they get mailed one for the state, and this stuff is in there. But page 20, if you're 65 or older, have group health plan coverage based on you or your spouse's current employment, and the employer has fewer than 20 employees, Medicare pays first. So then what'll happen is if that's your circumstance, then the small group employer only has to kind of finance and pay for a supplemental for you, which is going to cost them less. That's kind of probably what the logic is there.
That
No.
would be reasonable. No.
Medicare at this point does not care about vision, which is corrective lenses, but medically, like glaucomas and all that, you're fine. You're covered by Medicare. But right now, parts A and B are not covering prescriptive, or are they covering dental? So you will then decide, do I just, what I call it is you're self-indemnifying yourself by saving a little money and paying cash for your dental care, or you can buy an individual dental plan through Delta Dental, which I think they work with AARP anyway. So if you call AARP, I think they just send you to Delta Dental. Another one is Physicians Mutual Dental Plans. Either way you go, if you go with an Advantage plan because they're like, oh, we offer vision, we offer dental, fine. But what I'm saying is ask the questions before you enroll. Say, how do you cover dental? Where are your providers in network? So and then you make your own decision. Is it worth it to you to have the other limitations of the Advantage plans, like the networks, and get 50% coverage for dental? I don't know. That's your decision. Or even if you're looking at an individual dental policy, what exactly do they cover? You have to read that policy.
Thanks.
I stop short, and I'm very careful about like saying what you should do or what you shouldn't do. Like, we don't do that. We're counselors. We don't try to sell you anything. We're just like, we want you to do whatever's best for you with the knowledge of doing it. Like, do you really need dental insurance? I don't know. That's up to the client, you know? But right now, original Medicare A and B does not cover dental or prescriptive lenses. But if the Advantage plans are saying, we add that, we cover that, that's fine, but ask them how they do it.
Thanks.
Like, if you notice in the book, if you go to those pages where they show you the Advantage plans, you know, you'll see those monthly premiums are like $39, $89, $139, $62. Well, that looks a lot lower than like $168, $171 that you saw on the supplement chart. But if you keep reading across, you're going to see that you have constant payments. So it's your decision as to how you want to spend your money and your health status, really. Like, when you go and you buy your car insurance or homeowners, and the car insurance people, they say, oh, gee, do you want a $250 deductible? Or do you want a $2,000 deductible, right? They give you those choices. Well, it's the similar concept that if you have a $2,000 deductible, which is on you, you have to pay that. That's less risk for them. So your premium's lower, isn't it? It's the same concept with the healthcare choices. Kind of, you know, it's just an analogy. So your first step is to enroll in Medicare A and B, either right when you're retiring or when you're turning 65. You get the card with the dates on it and your number. You then decide, do I want to go the supplemental policy with a drug plan? Or do I want to look into those Advantage plans that combine everything? Those are your choices. And you can change your mind. Like, you know, you're not, if you try an Advantage plan and you change your mind during the open enrollment, you can switch back. All right, so great point. If they're still or she's still working and they're covered, it means they don't need Part B yet because she's got health insurance for both of them through her employer. That's fine. The reason they chose to just send her Medicare card with Part A only is because Part A doesn't cost them anything. You remember I said that most of us have worked long enough where if you look at your payroll, it's what everything they take out. right?
Mhm.
They take out Medicare. So you can go on Part A when you turn 65, that's fine. When she retires, she and her husband will fill out a short, tiny little form proving they've been covered. They send to Social Security and they say, we're ready for Part B. So then they'll both get a new card and they'll have an effective date for Part B on it. Yep, good point. You can get Part A only if you're still gainfully employed because it doesn't cost you anything. Whereas the Part B will cost you a monthly premium. But, you know, that's a good point too. If you were on Part A prior to January 2020, if you want, you could buy that F supplemental that covers everything because you were eligible for Medicare prior to January 2020. So you can still request that if it matters to you that Part B deductible is covered. That's the F plan.
Plan.
I mean, that's what makes the nuances of Medicare so incredibly complex because, the details can change and Congress can pass laws that affect it. And, so it's good that you're attending this and you're thinking ahead and asking all the right questions. Make sure that everyone takes my email because if they have any further questions, they can always email me and I can mail them a book or, answer any questions that we didn't get to.
But you're not meeting anyone in person at this point, are you, Libby?
I meet with people if they don't have email, are totally confused. I've met with 2 couples and we met outside and we wore masks. But typically they don't want us to, obviously. If a client has email, they know how to work the internet, like to go to ssa.gov, I can send them anything through email, scan stuff. I can mail the Medicare and U books. So that's how we've been attending to all our clients remotely. So we haven't really lost a step. But yes, I can meet physically with people if needed.
Okay, well, thank you so much, Libby.
Okay, I hope it was helpful and just contact me with any further questions, everybody. Enjoy the weather.